Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show.
Acyclovir. It is a pregnancy category B antiviral drug, specifically works against human herpes viruses. This word vir represents it is an antiviral drug. Acyclo represents acyclic sugar. In acycloguanosin, we all know that guanosin is a nucleoside. Here acyclovir is a nucleoside analog only, not a true nucleoside, because true nucleoside will have deoxyribose sugars or ribose sugars. Here acyclovir is having acyclic sugar plus purine guanine, that is nothing but acycloguanosin. Coming to pharmacology, it is available in oral, tablet, topical and IV formulations. It is a hydrophilic drug, hence only 50% of the plasma volume crosses blood-brain barrier. It can cross placenta and even found in breast milk also. As it is a category B drug, it is a safe drug during pregnancy. It reaches peak in just 1.5 hours to 2 hours and stays inside the body for 1.5 hours only, less T-half. Hence, we have to give more number of dosages per day. Actually, we have to give 5 times per day. But for patients' ease and convenience, we are giving 3 times per day. It has less bioavailability of around 20%, that is 15 to 30% only. As it is hydrophilic, absorption will be somewhat difficult. Plasma protein bound percentage is also less, 9 to 33%. It does not undergo any hepatic metabolism. So in liver patients, no need to adjust the dosages. It is mainly excreted via urine. Only investigation and monitoring we have to do is LFT. As it is hydrophilic, much of a drug won't get absorbed. The rest of the unabsorbed drug will be excreted via feces. Coming to its mechanism of action, it has a peculiar mechanism of action, as it gets activated only inside the virus infected cells. Hence, it has high selectivity and low toxicity. How it is going to get activated? Via phosphorylation. We all know that phosphorylation means adding a phosphate group by enzymes like kinases. Here, it is done by viral thymidine kinase. It will be available only inside the virus infected cells. See here, assume this box as a virus infected cell which has all the viral enzymes. Our hero acyclovir has entered the virus infected cell. Now virus will think it as a true nucleoside, but actually it is a analog, and it will think we can use this nucleoside for DNA synthesis to produce new virions which will further spread the disease. So virus will help our acyclovir with its enzyme viral thymidine kinase, which is the first and crucial step, and converts it into acyclovir monophosphate by gifting it a phosphate group. But to convert into acyclovir triphosphate, which is an active form, it needs 2 more phosphates, which will be helped by our host kinases. Then viral enzyme DNA polymerase will incorporate this acyclovir triphosphate into viral DNA. We all know that guanosin triphosphate is a nucleotide. Nucleotides are nothing but building blocks of DNA, which are essential for DNA synthesis. So after incorporating into viral DNA, as it is not a true nucleotide, it will just terminates the DNA chain elongation irreversibly. Hence, the entire DNA synthesis mechanism will be shut down completely and permanently. Even if viral DNA polymerase recognizes true nucleotides and tries to add to DNA chain, but DNA chain won't accept, as it has already got irreversibly terminated by our hero acyclovir triphosphate. It is undergoing binding competitively to viral DNA polymerase. and inhibiting it. With whom it is going into competition? True nucleotide guanosine triphosphate. I'll give you a best example. In movies, our hero will disguise himself like a gangster and will join a criminal gang. They will think we got a new member, we can use him and recruit more and more criminals. So they will help our hero thinking he is a gangster with their weapons like guns, and they will tell all their secrets. They will take our hero to head of the criminal gang. Here head of the virus is DNA. So after getting face to face with our head of the criminal gang, our hero will reveal his true identity, that he is not a gangster, he is a undercover cop, so and so batch, Indian police service, and will terminate him. So no more recruitment of new criminals, no more production of new variants. That's it. Claps from audience, movie hit. In the climax, same our drug Acyclovir also manipulating the virus step by step until it reaches the head of the department, DNA, and terminates it irreversibly. Coming to FDA approved uses, it works particularly against human herpes viruses. Now we will see one by one. Human herpes virus type 1 is HSV1, type 2 is HSV2, which will cause herpes labialis and herpes genitalis. In primary episode, we will give 400 mg TID for 10 days. This 10 days is given in books, but in STD kits, that is kit number 5, red kit, we will have 400 mg Acyclovir tablets 21, which is sufficient for 7 days. For herpes labialis, 400 mg TID for 5 days. For recurrent episodes, we will give same dosage, but for a period of 5 days. For suppressive therapy, when we will start a patient on suppressive therapy, when the patient gets a 6th episode in a span of 1 year, we will start suppressive therapy, 400 mg BD daily for a period of 6 months. After that, we will assess to continue or to stop. Usually, we will give suppressive therapy for a period in between 6 to 12 months. Remember, like this, until 5th episode, we will treat with 5 days only. When the patient gets a 6th episode, we will congratulate him and start suppressive therapy, which will be continued for a minimum of 6 months. Then human herpes virus type 3, which is nothing but varicella zoster virus. Name itself telling it will cause both varicella and herpes zoster. Same dosage for both varicella and herpes zoster. Nothing but shingles and chickenpox, 800 mg, double the dose of HSV1 and 2, 800 mg 5 times a day, more frequency also. Here 400 mg 3 times a day, here 800 mg 5 times a day for 7 to 10 days. Usually children only will get varicella, children 20 mg per kg 4 times a day for 5 to 7 days. Maximum dosage of that of the adult dose. What is adult dose here? 800 mg per dose. Even for children, if it reaches 800 mg, we have to stop there. 800 mg per dose, 4 times a day, 5 to 7 days. Apart from type 1 human herpes virus, type 2 and type 3, rest of all the uses will come under off-label uses only. Like primary gingivostomatitis, herpes gladiatorum, recurrent herpes labialis. Here I have mentioned only primary herpes labialis. In recurrent and suppressive therapy, I have mentioned herpes genitalis only. So for recurrent herpes labialis, it is an off-label use. Recurrent erythema multiforme, herpetic whitlow, herpetic keratoconjunctivitis, eczema herpeticum. If a patient of atopic dermatitis gets super infected with our human herpes virus, it will have a serious course. That's why we have to give IV formulation, as in them skin barrier is already disrupted. Our virus will have an easy access to spread and cause a severe disease. So we will directly give IV formulations. Next, Epstein-Barr virus. What is this? It is a type 4 human herpes virus. Epstein-Barr virus associated oral hairy leukoplakia also comes under off-label uses of Acyclovir. IV Acyclovir is reserved for oral drug failure cases. Why an oral drug will fail? Because it has low bioavailability. It may fail sometimes. Then we will go for IV Acyclovir, which will have 100% of bioavailability. As we are injecting the drug directly into blood circulation, no wastage. All the drug will be entering the blood circulation, hence 100% bioavailability. Where we will use this IV formulation? One is oral drug failure cases. Common sense. If tablets are not working, we will go for injection. Next, in immunocompromised and neonates, like neonatal herpes, as they have already their immune system is compromised, we can't take a chance and we will go for IV, because there are more chances for them to enter into severe illnesses. What do we mean by severe illness? Like disseminated herpes, herpes encephalitis, like complicated herpes, and trigeminal nerve involvement in herpes zoster. In all these set of groups, we will use our IV Acyclovir, which is particularly reserved for them. Coming to adverse effects, generally very less side effects. Only side effects are GI, nausea, vomiting, diarrhea, headache. As it crosses blood-brain barrier, also 50% will have side effects. Next, crystal-induced nephropathy, which is fortunately reversible. Even it is an adverse effect, but it is fortunately reversible. Hence, it is very important to counsel the patient whenever you are prescribing Acyclovir to take more oral fluids to prevent crystal-induced nephropathy. It is more in IV formulations, as more drug is entering the blood circulation. Coming to drug interactions, Acyclovir has very less drug interactions. Why? It is not undergoing any hepatic metabolism. Whatever the drug is causing nephrotoxicity, if we give along with them our Acyclovir or valcyclovir, it may increase its nephrotoxic effects. For example, FOS, CAR, NET. And it may elevate the serum levels of mycophenolates, like mycophenolate, mofetyl mycophenolate, sodium. Avoid live vaccines. Whenever we come across the word live vaccine, by default it means live attenuated vaccine. We won't inject directly live viruses, we'll attenuate them. But even after attenuation, it requires some amount of DNA synthesis to stimulate our immune system. What is our drugs doing here? It is shutting down the DNA synthesis. So, to avoid vaccine failure, we have to avoid live varicella and live zoster vaccines. 1 day prior the treatment and 2 weeks after the treatment. Investigation and monitoring, we already have seen liver function test. Coming to classification of human herpes viruses, against which our Acyclovir is acting. We will just revise. Already we have seen everything. HHV type 1 is HSV1, type 2 is HSV2. One causes primarily herpes labialis. That doesn't mean it will not cause genitalis. It will also cause genitalis if it gets access to genitalia. HSV2 primarily causes genitalis. That doesn't mean it does not cause labialis. It will also cause labialis if it gets access to oral via orogenital sex. HHV type 3, varicella zoster virus. In the name itself it's there, varicella and herpes zoster. Both the diseases are caused by type 3 human herpes virus only. That's why they named combining both the diseases varicella zoster virus. This varicella zoster virus, if it attacks a host for the first time, it will produce a disease called chicken pox, and some virus will stay latent in any one unilateral nerve trunk, and when conditions favor them like immunity, reducing immunity, increasing age, and exposure to UV radiation and any stress, this virus will get access and gets activated and spreads via the entire unilateral dermatome only. So it produces a localized disease called herpes zoster second time. Hence, it is also called herpes zoster virus. Coming to type 4 HSV, Epstein-Barr virus. What are the diseases caused by it? IOB. Not Indian Overseas Bank. I for infectious mononucleosis. O for oral hairy leukoplakia. We have already seen oral hairy leukoplakia comes under off-label use of acyclovir. Burkitt's, B for Burkitt's lymphoma. Not only Burkitt's lymphoma, various other lymphomas and carcinomas are caused by our culprit type 4 HHV Epstein-Barr virus. I have divided this table into two halves. For any kind of table which you come across, just divide it into two halves and study thoroughly first half of the table only. After a gap of one day, that is after an overnight sleep, come again and revise thoroughly. Then only you go for next half of the table. Until then you maintain the curiosity what will be there in next half of this table, so that you can study effectively. Not only any kind of the table, any question you start studying, first finish thoroughly at least half of the question, then only you take a break or quit studying on that particular day. Because even that half question, if you write perfectly, examiner will have a best first impression. Then rest half of the question, if you even manage with headings, no problem, examiner will give pass marks. We all know that first impression is always the best impression. Never quit any question without studying completely at least half of it. Coming to differences between valacyclovir and famciclovir. These two are nothing but pro-drugs. Why one has to create a pro-drug already if we are having a drug? Because to enhance the bioavailability, which may be a drawback of the actual drug. Here, acyclovir is a pro-drug of valacyclovir is a pro-drug of acyclovir. You can see bioavailability is 2 to 3 times that of the acyclovir. Famciclovir is a pro-drug of penciclovir with 77% of bioavailability. We all know that active form of acyclovir is acyclovir triphosphate. Same here, penciclovir triphosphate. Same viral enzymes they will also utilize. T half is also doubled that of acyclovir, 3 hours each. One peculiar feature of famciclovir is that it stays 10 to 20 hours inside the virus infected cell. Hence, it has an added advantage of prolonged antiviral effect. Uses same HSV1 and 2, HZV and varicella. But in famciclovir, varicella in children, the dosage and efficacy is not evaluated. Coming to individual dosages, for primary, 1 gram BD for 10 days. For herpes genitalis C, patients' convenience will be increased if they are asked to take only 2 times a tablet, 1 gram BD 10 days. For labialis, 2 gram BD for 1 day. In famciclovir, it is 250 mg TID for 10 days, 1.5 gram stat for herpes labialis. In recurrent cases of HSV infection, 500 mg BD for 3 days, 125 mg TID for 5 days. If you study primary episode dosages, you can exactly cut down into half. Here you can see 1 gram, here 500 mg. Duration also reduced to 3 days. Here you can see 250 mg. Make it exactly half, 125 mg TID for 5 days. Coming to suppressive therapy, we all know that if a patient gets 6th time, he is qualified for suppressive therapy for a duration of minimum 6 months. Here 500 mg 4 times a day, here 250 mg BD. Herpes zoster, valacyclovir dosage 1 gram only, but here TID for 7 days. Famciclovir 500 mg TID for 7 days. In varicella, dosage is same 20 mg per kg, but maximum dose here have to be that of adult dose. What is adult dose? 1 gram. Here maximum dosage is 1 gram. Even if it reaches adult dose, we can't increase more per dose. For 5 days for varicella, val acyclovir. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.